Well, hi, everybody, and welcome. We're going to get started now. This is Alan Hollander of ePractice Manager. We reduce organizational and management headaches and practices for owners and staff so they can all focus on what they really want to be doing, which of course is providing great clinical care. Now, our consulting team has been fielding a lot of questions from our clients around the country on the issue that our speaker, Tim Bowles, is going to talk about today. COVID, unfortunately, continues to be an issue with which we must deal. Many employers are mandating that staff, employees get vaccinated, and there are some very important things that you need to know about this. Tim Bowles is a very successful and nationally known attorney and expert on employer-employee relations and HR matters. We're delighted to have him back to talk about this very, very timely subject. So I'm going to turn this right over to Tim and let him get going. Tim, great to have you back today.
Thank you, Alan. It's good to be here, and I am eager to get into this with all of you. This is, shall we call it, a hot topic? I think that's an understatement, and it's a rapidly developing one. In that we have both federal and state policymakers expounding on this, and let's just start with the foundation here. As Alan said, first of all, I'm an employment management side attorney. Our law firm represents employers exclusively, and a very large percentage of our clientele are healthcare offices and, in fact, dental practices. And that's not just here in California where I'm speaking, but also across the country. I'm going to try to keep this broad, although California does continue to come into the conversation because it is, as you'll learn, the state that's taking the head of the spear in terms of mandating mandatory vaccination. And so we will take California as an example, whether it becomes the example that other states follow suit on, or whether it stands alone as it does now in certain ways, it has yet to tell. But you know, knowledge is power, and what we want to do today is equip you with enough perspective so that whatever state you're in, you can deal with the various ins and outs of this particular hot topic. So the idea here is that, of course, we still have this Delta variant that continues to push the numbers up. And that has, in the 18 months or so that we've had this crisis, evolved into another sort of level of focus and regulation. So let's start with the federal side. We understand that as a overall governing body of all 50 states and the territories, the feds have the regulatory power to direct action amongst its agencies, and that's what you see here. HHS, Health and Human Services, last week, August 12th, became the third agency to require COVID vaccination, and that was for over 25,000 workers, according to Forbes. The link is there. Just a little timeout here. These slides, about 22 of them, are going to be available to you in PDF form. Just contact the Hollander office, main office, and we're happy to provide that for you in PDF form. There are some other things that we'll discuss at the end of the session that we're also happy to provide you through my office with the contact information listed. So here we have the federal government with its power to actually direct mandatory vaccination among its own agencies. And then we have the bully pulpit of the president, and the power here in terms of the private sector becomes the power to encourage, the power to direct, the power to suggest, but not certainly to regulate. We will find, however, as we move on to the finer points, that there is a federal government agency which does have the power to define the boundaries of what a mandatory policy should look like once it is adopted. So we'll get into that a little later. But here again, it's interesting that the references I'm giving you are all within the past week or so. Here's one from the 11th of August, last Wednesday, where President Biden met with leaders of the private sectors, it says here, business, university, healthcare, and having met with them, asked each of these, and these are examples of employers, large employers in each of these fields that have issued mandatory policy to encourage other additional colleagues in their own industries to follow suit. So here's the president encouraging mandatory policy. But again, this is only to encourage. The federal government does not have the authority to mandate vaccinations for private sector. Meanwhile, we have the American Dental Association and their latest pronouncement. Again, this is just last week, that vaccinated individuals can still become infected. This is a series of bullet points I've summarized. It does continue to recommend, as the CDC, Centers for Disease Control, to recommend vaccination. And its last conclusion is that the overwhelming majority of cases currently are among individuals who are not vaccinated. So the ADA, again, private body, is encouraging it, but as a membership organization, of course, they can't reach and mandate mandatory, but they are pushing it. So this is the trend. It's going to continue to progress in this direction. And the bigger question in terms of how it hits home for each of us is whether it's a state or local direction. And here is the state with the authority to impose its policy, if that's the proper word, on private sector healthcare for the interest of public health. And of course, we've been experiencing that to one degree or another since February or March of last year. Or is it maybe a contradiction in terms, but if you can envision a voluntary mandatory policy, and what I mean by voluntary, of course, is that you as a healthcare provider have decided that the factors involved make it better practice to to require your personnel to participate in a mandatory program. There is nothing illegal about a mandatory program. I know of no state that's banned that. I know of no locality that's banned that. But on the opposite side, this is something open to you if you don't otherwise have a state that's requiring it. Now let's take a survey here of the current and changing situation in terms of state imposition, the state regulation or local imposition of a mandatory vaccination policy. This is as of yesterday. We had 21 states, including and the District of Columbia and Puerto Rico, which are taking action to require mandatory vaccinations. The vast majority of those are reaching toward initiatives of their own employees, state government employees, and only 6 so far by our count, including California, Connecticut, Delaware, Maine, Massachusetts, and Maine. I repeated Maine there. And it was New Jersey, by the way. It should be at the end there, not a second Maine, but New Jersey plus Puerto Rico have taken initiative to include private healthcare facilities and their employees within the mandates of required vaccination. But when we define healthcare facilities, there's only two so far, California and Puerto Rico, which have included within the definition of of affected healthcare workers in the private sector, dental offices. So that's why I said at the outset here that California is the leading edge of a trend that may well expand into other states. I suppose that depends on the staying power, if you will, of the Delta variant, or heaven forbid, other variants that arise and continue this crisis in the public health sector. So, as an example here, California, and again, this is only 2 weeks old. On July 26th, healthcare providers, and this includes dental offices, as you can see here, must verify the vaccination status of all workers, and I put that in quotes because there's a definition, and for those unvaccinated to require COVID testing at least once per week. So this is a reach into the mandatory realm. And you can see there's a little bit of wiggle room here in California. If it's not going to be a vaccinated status, it has to be testing status. And of course, strict masking requirements whether or not vaccinated. Workers under this particular California rule, again, only 2 weeks old, include all paid and unpaid people who have a potential for direct or indirect exposure to patients, et cetera, and affected with indirect, you can read clerical and administrative and billing personnel. Now, this gets down, if you're in California, to the employer's obligation to keep records, and we'll have that as a takeaway here. If you're in a state, or if you require, or you decide to do mandatory, one of the most important takeaways is to be able to well document what you're doing. And proof of vaccination in our California requires the CDC card or a World Health Organization yellow card. If you're an international traveler, you're familiar with that, with specific information on it. And we must also have a plan for tracking status here in California and records made available upon request to local health authorities. So this is our state of affairs here in California, except that last week, August 5th, or was it the week before? Anyway, 10 days ago or whatever, 11 days ago, even a tighter order has been issued by the Public Health Authority. Now, this doesn't involve dental practices, but it involves more congregational, if you will, or group facilities. Prisons were exempted from that, but nevertheless, clinics, hospitals, et cetera, now have to require vaccination. So there's no longer this opt-out in hospitals, for example, where you can test somebody who hasn't otherwise been vaccinated. People have to be vaccinated in these facilities. Again, dental was left out of that. But I'm just making the point that it's getting tighter and tighter here in California in response to the continuing Delta variant situation. Now, this is the hinge point, which is that if you decide to do a mandatory policy as encouraged by the president, as encouraged by the ADA, but it's not otherwise required per se by a law, you have this hinge point, whether it's by law or by your own choice, of allowing for certain exemptions. Now, this is where the federal government agency of the EEOC, which is the Equal Employment Opportunity Commission, comes into play. Now, they have been issuing, this agency has been issuing directives since the beginning of last year when COVID first arose to change the balance between what an employer can ask, the kinds of inquiries they can ask, the kinds of actions they must and can take, and on the other side of it, the right of employees to maintain their privacy in terms of medical condition, the religious belief, and it has changed the balance in the interest of public health. This agency has done that to allow employers to gain more access and to ask more intrusive questions into employee privacy of healthcare and health condition. So we can send symptomatic people home, symptomatic people. We may require testing to enter the workplace. Employers are permitted to take temperatures and develop an overall screening plan. And now let's take some of these one by one. This is important because when we get to mandatory policy on vaccination, you need to be equipped with the knowledge that this is certainly something now that is not prohibited, as I said. It is actually recognized as a necessity by choice of any healthcare employer, as long as we follow these restrictions, the guardrails, if you will, of the EEOC. So first of all, you can ask whether somebody's been vaccinated. That's not a medical examination by this agency. They don't regard it as that. It's simply to prevent infection. So it's not a procedure that talks about the existence of a health condition. So it's not private. We can ask that question. Now, here's the deal though. We can ask that question. But we can't ask why. If somebody you can only ask whether or not, yes or no. If somebody says no, that's where we need to have an education that you can't say, hey, well, why not? Because if you ask why not, then you may, as it says here on this screen, elicit information that a person has a medical condition, a disability, or a religious affiliation, which is their private information. And our questions have to be job related or consistent with business necessity. Now, here's where you might think this is a lawyer splitting hairs. Okay, maybe so. But the way that the EEOC has split this hair is you can't ask why not. Now, so here's an okay question, however. Now, is there any reason that would prevent you from receiving a vaccination? You see, that's a neutral question. That's not a question where you're saying, well, do you have a physical condition or mental condition that's going to prevent you? Do you have genetic characteristics that would prevent you? Do you have a religious belief? You're not asking the direct question. You're asking the neutral, is there any reason question? Okay, now, a person would say, and by the way, this is in passing, if someone just simply says, okay, we have a mandatory program, employer required, but we need you to go to wherever can be provided to you by a third party, and pharmacies now everywhere, healthcare facilities, et cetera, offer these. If that third party CVS pharmacy has asked the question of the employee, is there, do you have a religious belief? Do you have a medical condition, et cetera, that would prevent you? They can ask that question. They're a third party. They're not going to tell you what the answers to that are. But so they can ask the question. They're not the employer. So the EEOC has clarified that. But what I was getting to is that if we ask the question, is there any reason that would prevent you from receiving this vaccination? And of course, if the person answers, yes, I have a medical condition that prevents me from doing so. I have a strict religious belief. My tradition indicates I cannot do that. It's against my beliefs and practices, sincere beliefs and practices. Then it becomes our duty to inquire. And we can now have this conversation. Once they have originated a potential basis for an exemption, we can follow it down to find out, and I underline the two words, the key concepts here, whether or not there's a reasonable accommodation available, or whether or not we can't abide by that exemption, and we're going to have to say that it's an undue hardship for us to try to accommodate that. Now, at this point, if if it doesn't become clear to an employer how this can fall, whether we can abide by the exemption, and we'll talk here in a minute about what potential reasonable accommodations there are, or we're in this other grayer area where we aren't able to abide by someone asking to be let off. This is the time, if I may, that you would probably want to call your legal practitioner, your specialist in employment law, to help you through the process. Because if that point, and you know, there are other people who say, I don't want it because I don't believe in it, but it's not really a disability, it's not really a religion. I just stand on moral principle or what I've heard about vaccinations or whatever. If you're dealing with this sort of area, you might well want to consult with a legal practitioner who knows what he or she is talking about on the issue, so that person can guide you through, because documentation in that situation is absolutely critical. And how we respond to these requests for exemption on any basis, it becomes an alarm bell that we need to be part of the solution and not later being accused of part of the problem because we didn't actually document and make very clear that we are following what law we are required to do. And being fair, because, you know, at the end of the day, the thing I always counsel my clients on is, if an outside observer, it was a judge or a jury or whatever, it got really out of control and there was some kind of controversy, how that employer, how management responded to a particular challenge, saw the issue and enacted in a fair and responsible manner. That's the issue, is how's an outside person going to see this? And of course, that again is well documented steps in the event of any kind of touchy area. Okay, now we need to explore what is a reasonable accommodation. And as it says here in the guidance, we have to be flexible, interactive, whether it's necessary to obtain supporting documentation of the problem. In the case of a medical exemption, it would be very reasonable for an employer to ask that employee who is saying, I have a disability or medical issue, to ask that person for a physician's qualified healthcare written statement on just what sort of accommodations are necessary. We're not asking what that person's condition is. We're asking for a doctor to tell us, as an employer, just how far we have to accommodate that person. So that's a process, and again, we're on the side of solutions here. So we have to preserve medical information, of course, in any of these interactions, and excluding that unvaccinated worker has to be our last resort. Now, of course, we've been used to these protocols for some time now in terms of masking and social distancing, temperature taking, the other things we've touched on and you're well familiar with. We would ask, I would ask you, is it enough to simply ask an unvaccinated, a validly exempt from vaccination person to continue masking, which you're going to ask everybody in your clinic to do anyway, and document that that's what you've asked this person to do, or testing, as I touched on in the California example. It might well be that you want to have that person tested on a regular basis. California, once a week for dental offices here, it's a requirement. You could impose that sort of thing in a policy, or and of course in an individual resolution of the situation. And we come now to the considerations for a written vaccination policy. I think my first seminar with Hollander Consultants was on this issue was maybe February, and at that point, the vaccination issue was in its relative infancy. We hadn't developed a template policy then, and I promised that anyone who reached out to us directly to ask for that would get it once we had it produced. good news now is we have it produced, and we're happy to provide that. Now, this is, of course, with the understanding that if it is California centric, and if you're in another state and you ask and we provide it, happy to do that. Keep in mind that we're not going to be the experts in your state or locality, and you need to make sure with your own practitioners there that whatever you issue is going to be in compliance and adequately cover the state requirements or the local requirements. Certainly what you're going to find from us, though, is that you'll have these EEOC, these federal guidelines that are built into it. But you can see here 1 through 10, these are various aspects that should go into a mandatory policy, and they're all in our template. So again, if you're interested, please let us know. So our takeaways include 3 things. One, of course, is that the only thing constant is change. I put those capital C because that's been our life now for with COVID and the pandemic since it closed in on us March of last year. So be alert. Our policies, our template has been changing recently as well to keep up. The exemptions, as I said, sincere religious belief and medical condition, and written policy and thorough documentation are critical, as I touched on earlier. So in a short half an hour exploration here, I hope I've given you enough to think about and what I believe are the most important things. And the follow-ups here would include our weekly e-letter, which we publish up to twice a week. This is in many cases and it's free. It's for anyone who wants to subscribe. And these are on a whole range of issues. Their considerations and topics would touch on just about anyone nationwide. But we, of course, focus here on California as well. And as I said, the template policy. So that's direct contact with us. And we have model forms and a wider range of policies and workplace guidelines, not just COVID. We have a whole package of COVID material, which we just are just now revising once again. We issued, I think, next week. So that's for fee, and we're happy to entertain on a package basis, providing these sets of materials for you as well. Hey, Gillian, I understand that we may have some questions. Be happy to field those if you wanted to get on and let me know what people are asking.
Yeah, thanks, Tim. We had one question come in, and that is pregnancy a covered medical condition?
That's a very good point. It is a covered medical condition, and it's not a disability per se, obviously, but it is at least in a wider sense. But California, for one, and many states have pregnancy disability leave laws, for example. So they have placed this disability status, at least for the time of childbearing, newborn care, et cetera. And it's absolutely something that if someone raises a concern about mandatory vaccination relative to being pregnant, that again, that's when this duty to explore reasonable accommodation is our requirement. The interactive process to make a discussion out of it and have a resolution is vital on the management side. So yeah.
Okay, great. And we just had another person send a question in here. If a person becomes COVID positive and has to miss 14 days of work, is the employer obligated to retain their position?
I would indicate that it's probably the case that you want to hold that position. but it's individual and it depends on the circumstances. You certainly don't want to be hostile to the fact that someone has unfortunately come down with the condition, and the reasons for not asking them back and not able to accommodate an individual returning have to be very compelling in order for that to be justified. But I'll come back. Yeah, I come back again. The documentation has got to be the issue, part of that, and working with an experienced legal counsel would be another essential part of that in my mind.
Okay, great. Yeah, they did add after not having been vaccinated. So they contracted after not receiving vaccination.
I gotcha. And of course, vaccinated people, there's documentation that a small percentage of vaccinated people can come down with a condition regardless. So,
yeah.
Right.
Okay, great. It looks like those were the only 2 questions that came in.
Okay. Very good. Well, I hope this has been helpful, for all our listeners. When I started practicing employment law, which was exclusively, which is now 25 years ago or so, I guess, my jumping into this area from a wider experience in civil litigation and the courts was because I saw so many of my own community employers and managers who have built their practices from scratch, who have worked hard for their own livelihood and the livelihood of their families and so forth, needlessly putting themselves at risk and their business and their life work at risk for not understanding the very simple basics of employment law. So it's been our crusade here to fill the vacuum, to educate, so that prevention, whatever, 9/10 of what is it? An ounce of prevention is worth a ton of cure. So I hope I've been able to equip you all with some foreknowledge that will allow you to flourish and prosper without being sidetracked by needless claims that good work and good sense can avoid. So thank you very much for listening.
Tim, I'm sorry.
Look forward to the next one.
Tim, I'm sorry. We had one more question come in just now.
Okay.
If an employee is not vaccinated and it's not due to medical or religious beliefs, can that vaccination be mandated?
The answer is yes. In under the law, that can be mandated. I would again come back to what I said earlier, which is that if that's the case, and there are viewpoints out there that folks are hesitant to get vaccinated for some other reason than what would be a valid exemption. That requires a conversation as well, so that it's well documented just how this is going to be dealt with. And again, I would suggest dealing with legal or working with your legal counsel on that in that event. But the answer is no. That person is not protected by the law. You can require it. That doesn't necessarily mean they're going to agree. So there you go.
Okay, great. And then, all right, this we knew this was a topic with a lot of questions. So we did have a follow-up question come in from the attendee who asked about the pregnant exemption earlier. And now they're commenting that pregnant people, it's now being recommended per the CDC that they receive vaccinations, but they're still able to use it as a reason not to vaccinate, is the question, I think. So it's still actively a reason, even though it's being recommended they now receive the vaccinations?
Yeah, well, see, this would come back to what I said earlier in terms of a physician weighing in on this. Yeah, the CDC is recommending, federal government recommending, it comes down to an individual conversation with that employee, and asking that employee to come back with a physician and qualified medical professionals written conclusion that this particular pregnancy, and pregnancies are a spectrum as well. There may be touchy ones that where vaccination could be a risky thing. So we need that third party physician to weigh in on that. And even then, let's say the person is not being unable to get that clearance, even then you're having this reasonable accommodation versus undue hardship conversation with that person, regardless of what the federal government is recommending. So you may be hearing a theme here. If there's a gray area, if you have someone who has doubts about it, and even though you are confident as an employer that you're on the right side of what you can and don't have to do, you've got to have this well-documented conversation and a conclusion. So that's where we have to go.
Okay, great. And then it looks like I'm getting one more question here. If an employee is unvaccinated, who should pay for the weekly testing? Who's responsible for that?
Yeah, that's a really good question. I would suggest it would be our employers are on the hook for that. There's nothing that I'm aware of that requires it, but are we going to facilitate the smooth flow of our business? Or are we going to get sidetracked by a protest and a standoff on who gets to pay or who has to pay? I think it's just good sense that the employer ought to just put in place payment for that particular testing.
Okay, great. And final question, I'm sorry, folks, we got to wrap it up, but there is one more question here, and that is, if a person gets a vaccination against his or her wishes and develops any complications, or, I mean, gosh, dies, what's the liability on the employer? With something
well,
like
that's the first time I've been asked that question, but I suppose it's going to happen sooner or later somewhere. Well, first of all, if it was truly a workplace requirement, and the person led to that person's demise or that person's injury, it's more than likely a worker comp issue. So in a sense that would protect employers, but then, what are lawyers but creative innovators of legal claims? You could say that gives us a bad name. That's another conversation. I would certainly want to rely, of course, on the fact that anyone taking any sort of medical procedure is doing so with risks involved. So it's a question of, well, let's put it this way. The federal government has encouraged it. Some state governments have required it. The choice to make it a mandatory policy needs to be covered by insurance. So the policy ought to indicate that this is a work-related requirement, so it gets channeled into the work comp system if there is in fact this tragic result, which of course no one wants to wish on anyone.
Okay, great. That wraps up the questions. Thanks so much, Tim.
Very good. So as I say, I appreciate the opportunity, and I look forward to helping next time.
Great, Tim. Hi, everybody. Alan Hollander from ePractice Manager, back to you just to wrap this up. Tim, thank you so much. And by the way, I will say that I received the that e-letter I have for years that that you publish, and I encourage people to receive it. It's incredibly valuable information, as was this terrific info, Tim, and as usual. And we appreciate your sharing this with all of us. You know, for those of you who may have questions on how do you specifically use and apply what Tim has just discussed, you know, if it's a non-legal matter, of course, please feel free to reach out to us. You know, implementation and execution is the real key on anything that you want to improve or even just tweak in your practice. So we are delighted to provide any of our attendees to have a follow-up discussion with us to help you incorporate a system or even a tool or a policy into your practice. There's no charge. There's no charge because we want to see all of you benefit and get the full value of what's been presented. Our contact information is here on the screen. Give us a call, email us. We'd love to assist you. Thank you all for coming. Tim, once again, thank you so much for sharing your expertise. See everybody again. Thank you.
Thanks, Alan.